you know answer to this question or not. Okay, guys, first question. So your board examinations would have situation and then followed by 5 questions usually. So Nurse Resty plans to enhance her personal and professional development. Choose an indicators that model personal and professional behavior and values. A, utilizes communication and social media responsibly. That seems to be correct, but if you would look at it, is that needed for A, personal and professional behavior? Answers B. What do you think? Is that needed for personal and professional behavior? If not, most of you are answering D, attending conferences. Let's give credit to that. Enrollment to schools. Is enrollment to schools required for a professional? You need it prior to becoming a professional, but not on becoming once you become a professional already. Then D, join civic organizations. No, it's not expected from you. So the correct answer is bravo. Next, number 2, nurses should have knowledge about the APO, the Accredited Professional Organization. Which of the following is the APO of nurses? The quick answer for that is letter B, your bravo, Philippine Nurses Association Incorporated. Now, your MCNAP, if you talk about MCNAP is a specialty organization in nursing. So there are several specialty organizations in nursing. One example is your MCNAP. Another example is your CCNAP. You also have your ERNAP. Now, Maternal and Child Nurses Association of the Philippines, Critical Care Nurses Association of the Philippines, ER Nurses Association of the Philippines. There are so many specialty organizations. Okay? By law, what are you required to be a member of? Are you required to be a member of specialty organization or the accredited professional organization? You are required to be a member of your accredited professional organization, and that is your APO. Now, if you would be asked how frequently should you renew your membership for the Philippine Nurses Association, how many years should you renew your membership to the PNA? Yes, the answer for that will be yearly. Take note, you renew your PNA yearly. Now, there is a lifetime membership option for PNA, but you could only be a lifetime member after how many years? You could only be a lifetime member after how many years of consecutive membership? Answers? After how many years of consecutive membership can you be a lifetime member of the PNA, guys? You could only be a lifetime member once you have been a member for 5 years consecutively. Okay, 5 years consecutively. Now, if you would look at the National League of Government Nurses, as the term implies, government nurses. Okay. Now, if I am, for example, working in a state university, can I be a member of the National League of Government Nurses? If I am working in a state university, can I be a member of the National League of Government Nurses? Yes, you can. If you are working, for example, in the district hospital, in the medical center of the region, can you be a member of the Government Nurses of the Philippines? Yes, you are. As long as you are being paid by the public, you can be a member of the National League of Government Nurses of the Philippines. Now, the members of your ANSAP are your nurse managers, head nurses, up to your chief nurses. Okay? This involves nurse leaders in the society. What do you call naman the organization which is composed by the dean of the Philippine Colleges of Nursing? What do you call that organization composed by the deans of the Philippine Colleges of Nursing? So you have your ADPCN. Can the clinical coordinator be a member of the ADPCN? Can a clinical coordinator be a member? As the term implies, association of deans, so it's clearly for the deans. Okay, it's clearly for the deans. Now, let's talk about a profession. Number 3, a profession is characterized by the following exam. Is there a body of knowledge in the profession? Is there a body of knowledge in the profession? Sige, let's review muna. When I talk about a profession, the main characteristic of a profession could be summarized by the acronym SMS. It could be summarized by the acronym SMS. Anybody, you can tell me what is S? Don't look at the choices yet. What is S? So S would entail that there is specialized training. S would entail that there is specialized training. M would stand for membership. And then S would stand for blank orientation. Your S would stand for blank orientation. What is the S here? Service orientation. Okay? Kindly repeat that to yourself. Specialized training, membership, and service orientation. Now, when I talk about specialized training, guys, specialized training also stands for education. So if you would look at number 3, body of knowledge. Is there body of knowledge in SMS? Is there body of knowledge in SMS, guys? Your body of knowledge will be, I want to see your responses. Yes, there is. And that body of knowledge will be commensurate to your education. Okay, that body of knowledge will be commensurate to your educational degree. Yes, that's correct. Now, code of ethics. Yes, that's one. Because it's a profession, you need to have your code of ethics that is embodied here in the service orientation. That is embodied here in the service orientation. Then, member of professional organization, as indicated here in the M, membership. Now, is there engagement in research to become a professional? So the answer for number 3 is letter. The answer for your number 3 is letter D. Okay? So engagement in research is not to be considered characteristic of your profession. Okay? Kindly take note of that. Now, which of the following is an example of a self-directed learning activity? Self-directed learning activity. When I say, guys, it's a self-directed learning activity, what does it mean? Is it organized by a specific committee, or am I the one doing it by myself? When I say self-directed learning activity, okay, so it's by my own. As the term implies, self-directed learning activity. So which of the following is an example of self-directed learning activity? Now, let's say for example, let's look at it. Research at work. Sige, maraming sumasagot ng A, payagan. Now, attendance to webinar. When I say webinar, what do you think? Is it formal or self-directed? When I say webinar, is it formal or self-directed? It's considered to be formal because somebody would organize the webinar. Attendance to graduate school. Attendance to graduate school. Okay, when I talk about attendance to graduate school, it's also considered to be formal. If you are a resource person, it's also considered to be formal. Okay, so guys, this one, the answer for this one is letter A. When you conduct research at your work, especially in your own hospital, that's on your own volition. Nobody would be forcing you to do it. So research at work is considered to be a self-directed learning activity. Now, if you would look at the self-directed learning activity, this is actually aligned to the CPD law of the Philippines. Review, what is the CPD law of the Philippines? RA, 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 Answers? RA 9173, that never gets wrong. Okay, you want me to punch you. Okay, your CPD law of the Philippines is RA 10912. Very good. Okay, RA 10912. Okay, it was effective last 2016. Your CPD Act of 2016. Okay, on the part of the nurses, another legal basis is your Board of Nursing Resolution Series of Board of Nursing Resolution 21, 21, Series of 2017. But more importantly, you memorize RA 10912. If I will be talking about the CPD requirements for nurses, how many units are required every time that I will renew my license? How many units are required every time that I would renew my license? By the law, who told you 15? I'm so curious. What's with 15? What's with 15? It's not 15. Every time I will be renewing my license, how many units am I required of? Oh, may bago na ngayong 60. Saan nyo naman napulot yung mga 60 na yan? Okay? Now guys, before I go back to that question, every how many years will I be renewing my license? Every how many years will I be renewing my license? I need to renew my license every 3 years. Okay, renew my license every 3 years. What day of the year will I be renewing it? What day of the year will I be renewing my license? That would be on your birthday. Okay, that would be on your birthday. Now let's go back. By law, we are required to have 15 units per year, which means every time I will renew my license, how many units would I have? How many units would I have? Okay, I need to have 45 units. Okay, I need to have 45 units of CPD. If the question does not ask about the COVID-19, you don't need to answer 15. If you are asked how many units are required from the nurses, that would be 45 units. Okay, that would be 45 units. Now, there are different track, guys, for your CPD. Okay, let me see first the spaces here for me. Now, guys, for your CPD, you have different track. One of the track that you can have is what we refer to as your professional track. Another track that you can have is what we refer as academic track. And another track is what you refer as your SDL or self-directed learning. Now, if you participated in the program of an accredited CPD provider, what do you think is that? I participated in the program, in the webinar, in the research symposium of an accredited CPD provider. That would be your professional track. Okay? Now, guys, you need to be mindful that not all organizations who offer seminars are accredited CPD provider. They need to apply that to the PRC. They need to apply that to the PRC. Now, if I will be taking, for example, or let's say I would want to make a book about my favorite topic, what do you think would that be? Would that be a professional track, an academic track, or a self-directed learning? Trip kong gumawa ng libro para for my CPD units. What track is that? That would be belonging to your SDL. That would be belonging to your SDL. Now, let's say, for example, that I will invent a machine. I will invent a machine that could help promote world peace. Where would the machine invention go? Where would the machine invention go? Would it be professional, academic, or SDL? That would still be SDL. That would still be SDL. Inventions class would belong to your SDL. Let's say, for example, I am a consultant. I am a nurse, I am an educator, and I am a consultant to a training facility. What would that be? Will that be professional, academic, or SDL? Okay, marami po talagang sumasagot ng mga academic. Gising-gising po tayo. Okay, guys, to be a consultant still belongs on your self-directed learning. To be a consultant belongs to your self-directed learning. Okay, now let's say, for example, I am taking my doctorate degree. I'm taking my doctorate degree. What type of track is that? Oh, ito na, isagot mo na. Okay, class masters and academic, masters and doctorate degree would belong to your academic track. Okay, it would belong to your academic track. Let's say, for example, I'm a moderator in a seminar. I am a moderator in a webinar. What track could that be? A moderator in a webinar that I attended, of course. That's not SDL. If you are a moderator, that would belong to your professional track. Let's say, for example, that I am a speaker in a certain webinar. I am a speaker in a certain webinar. What would that be? To be a speaker belongs on the professional track. Unless the question will say that it was conducted by a non-accredited professional organization. If it is conducted by a non-accredited professional organization, that would belong to self-directed learning. Okay? Anything, guys, anything na may formal, that would belong to the professional track, except for your master's and doctorate degree. Okay? Now, if you are the resource speaker, let's say, for example, the seminar was approved for 5 units. How many units will the speaker receive? How many units will the speaker receive? 5 units yung seminar. Halimbawa, na-approve ng PRC. How many units will the speaker receive? Plus, the speaker may receive up to 15 units. The speaker may receive up to 15 units. Kapag speaker ka, times 3 ang credit mo. Kapag speaker ka, times 3 ang credit mo. Okay? Kindly take note of that. Now, again, for those who forgot it earlier, what is the CPD law of the Philippines? What is the CPD law of the Philippines? Okay, CPD law RA 10912. Okay, I hope that you will remember that. Now, let's proceed. Guys, this is just on the side. I just remembered this earlier when I was reading the question. I hope you're familiar with the Philippine Nursing Professional Roadmap for 2030. What's the vision for the Filipino nurses by 2030? What's the vision for the Filipino nurses by 2030? Anybody? Vision for Filipino nurses by 2030. Anybody who has an idea on that? Okay? Yes. Okay? So guys, Philippine professional nursing care, the best for the Filipino and the choice of the world by 2030. Very good. Thank you for capturing that. You need to be familiar of those. That's the vision of the Philippine Nursing Professions Roadmap 2030. Okay? Now, what are the core values of a Filipino nurse? What are the core values of a Filipino nurse? According to this roadmap also, what are the core values of the Filipino nurse? Okay? In the past, there were usually three. Yes, thank you for mentioning the three: the love of God, self, and country. Okay, in the past, there are three now. But right now, there are five indicated in your Philippine Nurses Professional Roadmap 2030. Very good for mentioning caring. So you have L, C, I, N, E. These are the five core values of your nurses. Okay, the five core values of your nurses. Okay, so L, as you mentioned, love of God will be there in the picture. A is caring, then I is integrity, and then plus N is nationalism, and then E is excellence. E is excellence. Okay? Plus, how can you recall that? Yung mga values na yan, guys, parang pangsini lang yan. Yung mga values na yan, pangsini lang yan. Okay? So L, love of God. C is caring. I is integrity. N is nationalism. And then E is excellence. Try to repeat that out loud right now, even without unmuting your microphones. Try to repeat that in your Coco brain, those five core values. Okay, pag nakasandad ang isa, good luck. Now, next, aside from attending webinars, I'm going to question number 5. Aside from attending seminars, which of the following informal continuing education program should the nurse engage herself except? Pagkakita sa board exam na may word na except, dapat i-encircle mo na yan. Okay, except, para ang focus mo nandyan. Now, attending professional organizations. Wait lang, ang sabi niya is attending informal. Okay, the question was, let us see. The question is asking following informal pero except. Ibig sabihin we are looking for the formal. Now we are looking for the formal. Yes, thank you for that, RN soon. So attending professional organizations, conventions. So pwede siyang formal, pwede siyang informal, no? Webinars, symposiums, doing research as an academic requirement. So if you would look at it actually, the four of them could be actually falling into formal. Diba? The four of them could be actually falling into formal. But if you would look at it, kung if we will apply which is the best answer, guys, it would fall here in doing research as an academic requirement. It would fall here as doing research as an academic requirement. Rationalization for that, di ba I mentioned 3 tracks for you earlier? Where is the 3 tracks? Ay, ito, lumiit. Okay? Plus, the professional track and the academic track are actually considered formal. The professional track and the academic track is considered formal. Oh, some of you might argue, sir, sabi mo kanina, webinar is formal. You also mentioned that symposium could also be formal. But di ba I mentioned to you that it would depend whether it will be conducted by an accredited professional, by an accredited CPD provider or a non-accredited CPD provider. So if you would look at it, the sure answer there is doing research as an academic requirement. Now try to look at this. The one that is constructing the exam would not want you to get wrong. The one who is constructing the exam would not want you to get wrong. Why? If all of the students would get wrong in the examination, later on during test item analysis, it would appear that the question is very hard and that question would not be repeated again, or that question will be considered to be unreliable. Okay, let's say for example, a very big amount of the population got wrong in the answer, that will be considered unreliable question. So meaning, the one who's constructing the exam would try to give you clues as to what is really the answer. So that's why she indicated there as an academic requirement. Because once it is already specified as an academic requirement, you're sure it's formal. You're sure it's formal. Okay? That's why if you're in doubt that all of them are correct, you try to look at for the clues. No? You try to look into the clues. Now let's talk about Sylvia, assigned in the PB Award for 2 years. He wants to join the team of nurses who will be conducting a study on sleep. The team leader wants to be assured that Nurse T is equipped with a basic knowledge of nursing research. Some of you might be asking, sino si T tapos sino si Sylvia? Okay? Walang kinalaman yan sa question, so don't focus on that. The team leader decided to ask Sylvia the meaning of informed consent. After being able to define the term, she was further asked questions. Nurse Sylvia's answer should be which of the following? Okay, purpose daw ng informed consent. Let's look at number 1. Fully understand what the research is all about and what will happen should the participant opt to involve themselves in the research study. Correct or not? Correct or not? Okay, it's correct. Okay. Now, 2, to get assurance that the participants have the right to withdraw from participating in the research at any given time. Can my participants withdraw at any given time? Yes and yes, di ba? Pwedeng mag-leave anytime. To get complete and full information to the objectives, procedures, implement data collection, benefit, harm, options in the method of treatment. Appears to be correct also. And to get assurance on how anonymity and confidentiality will be maintained. That is also correct. So if you would look at it, is there an all of the above there? Okay, so the answer is 1, 2, 3, and 4. Okay, 1, 2, 3, and 4. Okay. Now, by the way, before I would miss this side note of mine, who is the current chairperson of the PRC? Who is the current chairperson of the PRC? Hoy, gising. Yung mga sumagot kay Doktora Elsie Te. Okay, gising, gising. So, Filopilando po is medyo matagal na po. Pinalitan na po yan last year or last October. Okay, the current PRC chairperson is Honorable Charito Zamora. Okay, the current. I saw somebody who answered it correctly. Congratulations. I'm sure you will be getting your license. Okay, guys, the current PRC chairperson, take note, I am asking for the PRC chairperson. I am not asking for the PRC BON chairperson. I am asking for the PRC as the Philippine Regulatory Commission, the Professional Regulations Commission. I am not asking I am not asking guys for Dr. LCT. Okay, tipid mo mag-Dr. LCT. Okay, okay, so again, the PRC chairperson, okay, thank you RN 2022, Attorney Charito A. Zamora. How many chairpersons does the PRC have? How many chairpersons does the PRC have? Wow. Take note, I'm asking about the PRC. I'm asking about the PRC. There's only one. How many commissioners do they have? How many commissioner do the PRC have? I'm still asking about PRC. I'm still asking about PRC. I'm not asking about the PR Board of Nursing. Okay, there are 2 commissioners. There are 2 commissioners. Okay, guys, don't be confused. I'm just asking about the PRC. There is 1 chairperson. There are 2 commissioners. Okay, there is 1 chairperson. There are 2 commissioners. Okay? Sa mga hindi pa nagigising sa katotohanan, now let's talk about the PRC Board of Nursing. When I talk about the PR Board of Nursing, how many members are there in the PR Board of Nursing? How many? The total of 7. There are total of 7 members. And there is 1 chairperson and 6 members. There is 1 chairperson and then there is 6 members. Okay? Kindly take note of that. Kindly take note of that. Now, I am getting my license. You passed the board exam. You got your license already. Whose signature will be there? Whose signature will be there? Is it that of Attorney Zamora or is that by Honorable Te? You're getting your license. Whose signature will be in the license? Both kayo dyan. ID yan. Hindi magkakasya lahat. May signature mo pa. Whose signature will be there? PRC license, that would be Zamora. Okay, PRC license, Zamora's signature should be there. Now, I am getting my certificate of registration. I am getting my certificate of registration whose signatures will be there. Okay? Okay? Lahat po sila. Okay? The 7 members of the board and then you have your Zamora. Okay? Ma'am Elsie and friends. Ang kukulit. Okay? Sige, So take note of that. Again, when I talk about the PR Board of Nursing, how many members should be there in the PR Board of Nursing? There are 7 members. Okay? Trivia lang, baka mapakinabangan. Who's the member from Region 6? Who's the member of the Board of Nursing who came from Region 6? Who's the member of the Board of Nursing who came from Region 6? May Melvin? May Melvin bang ano? Very good. It's Dr. Merly Salvani, no? It's Dr. Merly Salvani. With all due respect to Dr. Glenda Arquisa, Dr. Glenda Arquisa is already retired, no? I'm not sure if the term retired is correct, but she is not already part of the Board of Nursing. Okay? Sige. Okay. What is the requirement for you to become a member of the Board of Nursing? What is a requirement for you to become a member of the Board of Nursing? Acronym? 4 letters lang yan. Is it RFMM? Really? Is it RFMM to be a member of the Board of Nursing? Yes, it's RTMM. And when I say ROM, oy! Gising! Babatukan ko kayo one by one. Ay! Nagkamali lang ng type. Ang layo ng O sa P, no? RTMM. Okay. When I talk about members of the Board of Nursing, guys, how many years of experience? How many years of experience? Very good. There should be 10 years of experience and the last 5 years of which must be in the Philippines. Take note, 10 years of experience and last 5 years in the Philippines. Palusot mo muna sa mga 5-5 nyo. Okay, kindly take note of that. Now, somebody has mentioned ROMM. ROMM is requirement for, okay, faculty, okay, the faculty of the College of Nursing. Okay, so you need to have 1 year of experience and then you need to have your master's degree for you to qualify as the faculty of the College of Nursing. Uy, review kayo dyan, ha? Review. Yes, you need to remember his voice in the RTMM, ROMM, RFMM. You need to review those. Now, if you are the PRC chairperson, is it okay to have a master's degree in education or is it necessarily to be master's degree in nursing? Okay lang ba kung chairperson ka na master's degree in education or necessarily master's degree in nursing? Okay? If you are the chairperson of the PRC Board of Nursing, you need to have master's degree in nursing. You need to have master's degree in nursing. That's the requirement. And then majority of the members should also have master's degree in nursing. Majority of the members should also have master's degree in nursing. What are the 3 areas of nursing that needs to be represented in the PR Board of Nursing? What are the 3 areas of nursing that needs to be represented in the PR Board of Nursing? Yes, community is 1. MS. Babatukan part 2. Service, education, and community is correct. Thank you very much for saying that. You will be an RN, okay? Yes, service, education, and education and community. Very good on saying those words. Okay, guys, in fact, if I'm looking at the members of the Board of Nursing, I'm looking at the names right now. They are all Doctor of Philosophy and Nursing degree holders. My memory serves me well. So, pero the requirement is master's degree in nursing pa lang man. Now, what is the PRC Modernization Act of 2000? What is the PRC Modernization Act of 2000? RA 8981. Very good. Magiging nurse ka. Okay, mga alert sumagot by this time, I can really feel that you will be nurses. Okay, now let's go to number 7. As the observance of respecting privacy, Nurse Sylvia explained about. Okay. Bakit may mga sumasagot ng confidentiality? Wait lang, napaisip ako tuloy. In observance under privacy, Nurse Sylvia explained about, okay, answer, basta nandyan si anonymity at saka si confidentiality sa question, the best good man is to choose between the two, no? B and D para sure. Okay guys, we're talking about privacy. So when I say privacy, the answer would be anonymity. Okay, privacy class that refers to anonymity. Now, let's just differentiate privacy and confidentiality. When I say privacy, to whom does it refer? Does it refer to the person or does it refer to the information? When I say privacy, does it refer to the person or does it refer to the information? Very good. Yung mga sumasagot ng person, very good. Yung mga nagdadalawang isip, pag girl, nagdadalawang isip din yung license mo. Now, when I talk about confidentiality, your confidentiality refers to information. Okay, your confidentiality refers to information. Now, for example, I am securing that all of the data is kept in a password-protected computer. All of the data is kept in a password-protected computer. What am I ensuring? Is it the privacy or the confidentiality? I am ensuring the confidentiality of my patients, of my respondents. I mean. Now, if I am not, for example, in the questionnaire, I wrote name, but I would say optional. What am I protecting? I wrote name, but it is optional. I am protecting the anonymity slash privacy of my patient. Okay, I am protecting the anonymity slash privacy of my patient. Very good. Okay. Next, in nursing, Sylvia explained that the main goal of conducting research is to, okay, kung ako titingnan, letter B sasagot ko kasi it's the longest choice. Kidding aside, okay, now let's proceed. A, justify the role of nurses as healthcare provider. Can research do that? Yes, no? A, can research do this? Yes, no? B, establish a credible body of evidence to support and improve the delivery of care. Is this correct? Body of evidence to support and improve the delivery of care? Yes na yes. Okay, I like that. Okay, the keyword there actually is improve the delivery of care. If you would read textbooks in nursing, it would say that that is the primary goal of nursing research. That's the primary goal of nursing research. Okay, pero let's give it a chance. Punta tayo kay C. Identify research priorities that will justify the oversupply of nurses. If I would look at letter C, what's the wrong word there? What's the wrong word there? Okay? Under yan dapat. Very good, no? Oversupply is wrong. Okay? That's why I told you guys that the one who made the exam will be giving you clues so that you can eliminate the choices. D, develop a body of knowledge to address a non-nursing problem. Okay? Look at letter D, ha? Non-nursing. And then look at the choices in nursing. In nursing. So guys, the answer is letter B. Sir, paano mo na out ang A? Guys, A is actually covered under letter B. So you're choosing the umbrella answer because that answer could cover letter A. Okay, yes, ang galing ng mga umbrella nyo. Next, number 9. In conducting a study on sleep, Nurse Sylvia was asked which type of research will be used. Should it involve collecting numerical data? Let's underline, let's circle, or whatever you want to do, which is most often under considerable control. Her answer should be, okay, guys, pagkakita nyo ng numerical data, tapos nag-answer pa kamo sang ethnographic, phenomenological, kag qualitative, please i-unfriend nyo na lang ako sa Facebook, ha? Kung friends kita sa Facebook, paki-unfriend na lang sa akon. Once numerical, guys, that will be your quantitative. Okay? Once numerical, it will be your quantitative. When I say qualitative, what is my data in qualitative? What is my data in qualitative? What is my data in qualitative? You're talking about narratives. Very good. Kahit walang letter N, okay na. Okay, narratives. We're talking about narratives. Sige, let's differentiate muna quanti and quali because in the board exam, it will not just be numbers and narratives that we will be talking about. When I talk about quanti, okay, cute kay Balbazor, no? Balbazor. Okay, sulat-sulat tayo, quanti and quali. Who between the two believe or is grounded on constructionism? Who between the two is grounded on constructionism? Okay, and then there was moment of silence. Okay, guys, when I talk about qualitative research, it's grounded on constructionism. Okay, that will be your quali research. Who is grounded naman on positivism? Who is grounded on positivism? Kaya nag-ask ako una, quali, next na yun, quanti. Who's grounded on positivism? Okay, wala na. Hindi sila sure. Hindi sila sure eh. Okay? Guys, positivism, that will be your quanti. Okay? Positivism, that will be your quanti. Sir, bakit? Guys, when you talk about positivism, this is the message of positivism. Okay? Positivism is telling you that reality can be measured. It tells you reality can be measured. In other words, it can be observed by your five senses. That's the message of positivism. Positive siya, nga ma-measure mo yan lahat. It can be observed by your five senses. And very good on saying naturalism. Okay, this is grounded on naturalism. Okay, now, when I talk about the use of scientific method, if we are differentiating them, where is the use of scientific method? That would be on your quanti. Tapos, pag marinig kayo ng quality researchers, they will argue that they are also scientific. Now, if I talk about empiricism, empirics, ay, quali, ang license nyo nagbalik. Okay? Empirics, when I talk about empirics, guys, no, you want to, it's measurable. Yes, it's senses. Okay, so that is still referring to your quanti. Kala nyo papalit-palit here. Now, if I talk about deductive reasoning, okay? Yes, very good for saying deductive is general to specific, okay? Guys, sa mga confused pa kung anong deductive, the term there is deduct. So it's from big to small. When I say deduct class, it's from general to specific. Saan siya mabilong? Quantitative or qualitative? Quantitative or qualitative? Yes, your deductive reasoning would belong on quantitative. Anong opposite? Obviously, si inductive mapupunta kay quali. Si inductive would be in quali. Now, if I would look at quanti and quali, who is concerned of theory testing? Aba, okay. Sige, para medyo ma-enlighten tayo sa mga sumagot ng quali. When I talk about grounded theory, where does grounded theory belong? Saan napupunta yung grounded theory? Grounded theory is quali, and grounded theory is making a theory. So I'll go back to my question. Theory testing. I want to test the theory. Where would that be? Quanti or quali? Theory testing, guys, would belong on quanti. Theory testing would belong on quanti. And then when I talk about quali, yes, theory generating. Okay? Or oftentimes we use the term theory development. Okay? Theory development or theory generating. Okay? Don't look at your notes. Just look at your keyboard and then try to type. Use of five senses, quanti or quali? Use of five senses. Next question. It tells us that reality is subjective. According to this idea, reality is subjective. Quanti, quali. That's quali. That's quali. It tells us that reality can be measured. That would be your quanti. Okay? It helps us develop theories. Okay? One. Bakit iba-iba yung answer? Develop theories. Hoy, ang sumasagot ng quanti ay ikis ang license. Balik. Okay? So guys, development of theories, as I've mentioned, grounded theory is under qualitative. Okay, so that is theory development. So that's qualitative. Yes, theory proving is quanti. Okay, thank you for the insights. Now let's proceed. Should the 24-hour period clinical observation and activities be considered in conducting the research on sleep? The type of study that Sylvia will be conducting is, kulit 24-hour period, clinical observation and activities. What type of study is Sylvia doing? Many are answering B. Somebody's answering exploratory. Okay, guys, now let's try to rationalize. Sir, quanti, kay sleep. Okay, if you would look at the data, it says clinical observations and activities. Are these purely numbers? We are not sure. So let's give it a question mark. B, descriptive. Am I describing the clinical observations and activities? Can I describe them? Okay, so pwede nating lagyan ng check. Pero don't be happy, ha? Don't be happy nga may check ka that will be the answer. C, ethnological research. And some of you will say, wala man sang ethnological research, ethnography man. Okay, now, if that's pertaining to ethnography, what are we studying in ethnography? What are we studying in ethnography? We are concerned of culture. Very good. That's the keyword. And when I talk about culture, that pertains to your beliefs, that pertains to your practices. Okay, that's culture. That's the keyword for ethnography. So culture, usually ethnic groups, but take note, I'm using the term usually because it does not always mean na ethnic group siya. But if it's always about culture, it's ethnography. Now, exploratory. When I explore something, when I want to explore something, do I know anything about this topic? Okay? When I say exploratory, you don't know. That's the keyword. Exploratory, you don't know. Wala kang alam about dyan. That's why you would want to explore it. Now, if you would look at it, 24-hour period clinical observation and activities, you think it's exploratory? It's nada, because we already know something about sleep if you would look at it based on the scenario. So the answer for this one is letter B. Okay, the answer for this one is letter B. Bravo. Okay, ang mga nag-B-boy pa dyan, patawain kayo sana. Tara, research coordinator of tertiary hospital, where there was a growing concern of patients and family complaints that the nurses are rude and cranky. In response to this, she organized a core group to conduct a study on the caring behavior of staff nurses and satisfaction of women with ostomy. Okay? Based on the research statement, what is the independent variable? When I say independent variable, what is it? Is it the presumed cause or the presumed effect? When I say independent variable, it's the presumed cause. So independent cause. In other words, siya ang number one, siya ang nauuna. When I talk about the dependent variable, it's the presumed effect. In other words, siya yung number two. Okay? Now, if I would look at this, what is the independent variable? Your answer? Letter B, caring behavior. Now, let's talk about staff nurses. What is staff nurses here in this study? What is staff nurses here in this study? Okay, your staff nurses are your, antecedent, pack. Okay, they are the subject of your study. Very good. They are your study population. They are the respondents of your study. Now, women with ostomy. Women with ostomy. Wala, no? If you would look at it, they're not even the concern here. Okay? Yes, they are actually the receiver of care, but when it comes to identification of their role in research, wala, no? They're not the major here. They could be actually the part of your significance of the study. They are the recipients. Okay? And when we talk about satisfaction, your satisfaction would fall as the dependent variable. So the answer for number 12 is your satisfaction. Okay? Number 11, that's caring behavior, letter B. And number 12, that will be the degree of satisfaction. Now, let's say, for example, I will be talking about absences in clinical area and grade in MS. What is the independent variable? Absences in clinical area and grade in MS. What is the independent variable? That will be your absences. And what would be your dependent variable? What would be your dependent variable? That would be your grades. Okay? If confused ka pa, just ask yourself which would come first. No? Is it the absences or the grade in MS? Now, let's go to number 13. What are the relevant related literatures that Nurse Tara and her groupmates can utilize in this study? What are the relevant literatures that Tara and her groupmates could utilize for this study? The answer would be, okay, let's see. Charging. 1 and 3. Okay, somebody's saying 1 and 3. Somebody says C. Okay, now let's look at it. Caring behavior. Is caring behavior included? Caring behavior is surely included, no? Because it's the major nga. Ostomy pathogenesis. ostomy pathogenesis. Are we concerned of the ostomy pathogenesis? No, we are not. How about contentment and satisfaction? Contentment and satisfaction. Yes, we are. How about concept of body image? How about concept of body image? Are we concerned also of the concept of body image? Excuse me lang. Okay, I'm so sorry for the disruption. Okay, let's start. Going back, caring behavior is really a part of it. Then ostomy pathogenesis, we are saying it's not. Contentment and satisfaction. Are we sure of the contentment? Contentment and satisfaction, is it considered part of this? Part nga ba siya? Yes. Concept of body image. Concept of body image, most of us are saying no. Now, your answer would go down to 1 and 3. You look at it. Is there 1 and 3 on the choices? Yes, there is. So that will be our answer. Letter C. Okay, letter C. Now, if Nurse Tara and her core group would decide to formulate a directional hypothesis, it will be. Now, let's talk about the hypothesis first before we answer this question. There are two main types of hypothesis. What are the two main types of hypothesis that we have? What are the two main types of hypothesis? You have your null and alternative. Very good. The two types of hypothesis that you have is your null hypothesis and your alternative hypothesis. When I say hypothesis of no difference, that will be your null hypothesis. When I say hypothesis of no relationship, that would be your hypothesis of no relationship. Oh, may sumagot na ng alternative. Hey, be careful, ha? When I say no relationship, that would still pertain to your null hypothesis. Now, if I say the hypothesis of equality, oh, be careful, yung sumasagot ng alternative. When I say no relationship, no difference, that is your null hypothesis. Okay? Let me go back to my question. The hypothesis of equality. Okay? May nakita ko kanina, sumagot ng alternative. O, ayan, lumabas na. Okay? Guys, when I say there is no difference, are they equal? When I say there is no difference, are they equal? Yes, they are. So the hypothesis of equality is also your null hypothesis. Okay? And obviously, the opposite of that will be your alternative hypothesis. Okay? So the hypothesis of difference, the hypothesis of relationship, and then the hypothesis of not equal is your alternative hypothesis. Okay? Kindly take note of that. Now, if I would say, for example, I will say the weight of the boys and the girls are equal. The weight of the boys and the girls are equal. What type of hypothesis is that? That's the null hypothesis. I will say there is a relationship between number of times attending review and scores in LLE. There is a relationship, so that would be an alternative hypothesis. Let's say, I will say, the weight of the boys is higher compared to the weight of the girls. That is considered an alternative hypothesis. I will say there is no significant difference between That is your null hypothesis. What is the symbol that we use for null hypothesis? What is the symbol, guys, that we use for null hypothesis? Very good. You have your HO. And what is the symbol that we use for alternative hypothesis? Very good. That would be your HA. Now, let's go to the two types of alternative hypothesis. You have your directional and then you have your non-directional. Okay? Guys, pag may directional, isipin nyo lang ganyan. Pag sinabi kong directional, may words na lesser, higher, okay? Parang kumbaga, it points out to a certain direction. But when I say non-directional, it would just say that there is a significant difference, there is a significant relationship, but it does not tell us what type of relationship. Okay? Let's practice. Tell me if this is directional or non-directional. The scores in NLE is directly related to love life happiness. The score in NLE is directly related to love life happiness. I said the scores in NLE is directly related to, you are confused by the word directly. It's not giving you any direction, guys. If you look at this, it's not telling you whether the relationship is positive or negative. So it's non-directional. That is non-directional. Correct. I say that there is no significant difference on the weight of the male and the women. There is no significant difference between the weight of the male and the female. Okay? Yes, very good for saying null hypothesis. Now, if I would say that the higher the intakes of fat, the higher the risk for cholesterol problems, that would be directional. If I would say that there is a positive relationship between happiness in love life and scores in NLE, there is a positive relationship. There is a positive relationship. Okay? May mga sumasagot pa rin ng non-directional. The word there is positive relationship. Positive is pointing you out to a certain direction. Positive is pointing you out to a certain direction. Okay? Be careful and try to watch out for the words there that gives you clues. Now, let's say directional hypothesis. Okay? If I would go back to the question, there is an increased relationship between the caring staff nurse. Is A an answer? Nobody's saying it's A. The caring behaviors of the staff nurses is related to increased satisfaction of ostomized patients. Okay? You're saying that B is the answer. The staff nurses' behavior have an effect on the patient satisfaction with ostomized patients. Okay? Sinabi lang na effect. Is it clear whether may direction or wala? There is no direction for letter C. There is a significant relationship. It says that there is a significant relationship. However, it's not indicated if what type of relationship. So it's also not included. Now, there might be a confusion on A and B. How do we rule out A? What's wrong in A? What's wrong in A? Sige na. Because if I would look at it, A kasi and B could be correct answers, di ba? Kasi both sila may word na increased, no? Both of them have the word increased. Okay? Relationship, no? Okay? Okay? But guys, if I would look at it here, the word increase kasi is not used to describe the relationship, no? It's best to be used by the term positive and negative. Okay? We use the term positive and negative. Okay? So if I would look at it, B is the better answer, Kidman. B is the best answer for this one. Okay. Now, if I would go back to the concepts in research, what do we mean? What's the term that corresponds to educated guess? What's the term that corresponds to educated guess? That would be your hypothesis. If I talk about statistical hypothesis, what the statistical hypothesis stands for? When I say statistical hypothesis, is it the null or the alternative hypothesis? When I say statistical hypothesis, okay, very good. Your statistical hypothesis is your alternative hypothesis. Okay, I think we're good with that. Now, based on the research problem, what is the research design of the study? What is the research design of the study? Ano tong study? Okay, let's go back. What was the study? The study is caring behavior of staff nurses and satisfaction of women with ostomy. Is it the same study or another na? Okay, it's the same. Okay, so what type of research is that? Okay, that would be descriptive. Okay, that would be descriptive. Now, let's talk about experimental researches first. How can I say that something is experimental? How can I say that the research is experimental? What are the things that needs to be fulfilled for us to have the experimental research? Okay, you need to have your RCM. You need to have your RCM, randomization, then you have your control, then you have your manipulation. Okay, so you have your RCM. Once the R is gone, what do you call that type of research? Once R is gone, you would be calling it as quasi-experimental research. Okay, you would be calling it quasi-experimental research. Now, how about if control is gone? How about if randomization and control is gone? Sige ha, pag sinabi kong experimental, sabi natin sa experimental, there should be RCM. Once, guys, that R is gone, that will be considered quasi-experimental. How about if it is your control and then randomization that is done? If manipulation na lang yung nagstay, pero walang control at saka walang randomization, what type of research is it? What type of research is it? Okay, biased research. Inis. Okay, guys, that will be your pre-experimental type of research. Okay, that will be your pre-experimental research. Okay, now let's talk about ex post facto. When I say ex post facto, what are we looking into? The past or the present? If I'm talking about ex post facto research, what are we looking into? The past or the present? Okay, we are looking into the past. Okay, we are looking into the past. That's why it's referred to as ex post facto. Kumbaga, the research is conducted after the fact. Okay, after the fact. Yes, thank you RN 2022 kasi nga X siya, di ba? Okay, sige, what else? Now, based on the timeline, there are two types of research. You have your retrospective and then your prospective research. If I am starting the research now and we look into the data into the future, will it be retrospective or prospective? If into the future, that would be prospective. If I will be looking into the data in the past, what type of research is that? That would be retrospective. Okay, that would be retrospective. Okay, now let's go to the next question. The hospital research cohort is discussing the basics of research with the members of research facility as part of the continuing education. Question and answer are also part of the program. What a situation. During the open forum, the hospital research coordinator raised the question, who among the following provides information in the questionnaire? Who among the following provides information in the questionnaire? Okay. Now, let's talk about participants. When do we use the term participants? When do we use the term participants? Very good. We use that in qualitative research, especially if we are conducting what type of interview? What type of interview are we conducting? Phenom kayo dyan. Type of interview, tinatanong ko. What's the type of interview? Close-ended pag yun. You don't do close-ended questions. Guys, qualitative research, you have your in-depth interview. That's what the word I'm looking for, in-depth interview. But if I'm talking about open-ended and close-ended, you use open-ended questions. You don't do close-ended questions. Now, key informant, when do I do that? When do I do the key informant? What type of research? Quanti-quali. That would still go back to your quali research. Okay? What do you call it? When I will be, for example, I have key informants who are all experts in the field. For example, I want to study on cancer, and then I call the expert from the Philippines, I call the expert from the Baguio, I call the expert from whatever part. Wow, panel interview daw. Ano to? Pageant? Very good. Delphi technique. Okay, very good. That will be your Delphi technique. If you will be gathering experts study. Ay, Diyos ko Lord. Okay? Now, kidding aside, so class once your key informants are experts on the field, that will be your Delphi technique. Now, let's say, for example, I want to conduct an impact study on a certain community. And then I call the barangay captain. I call those people who were recipients of my project. Who are they? Are they participants, key informants, respondents, or subjects? They are key informants. Very good. Now, I distributed questionnaire across the globe. They are your respondents. They are letter C. Nakakainis you. Subjects. When do we use the term subjects? In what type of research? In what type of research do we use the term subjects? Very good. We use that in experimental research. Yay, do may license na kita. Next, one of the members of the research committee wishes to conduct a study involving an interdisciplinary colleague. Okay, interdisciplinary colleague. What type of research is that? That would be your collab research. That would be your collab research. Now, one of the term here emerge, that's your applied research. Now, let's differentiate muna the two basic type of research, basic and applied. No? The types of research, basic and applied research. When it talks about knowledge, yes, I can hear something. Okay, if you will be asked, the basic and applied are the types of research according to purpose. That's the type of research according to purpose. Okay. Okay, thank you for saying that pure is basic. Thank you for that input. That's excellent. Pwede ka nang magka-license. Okay, so pure or basic, and then you have your applied. Now, when I talk about a research undertaken to extend the base of knowledge and discipline, the base of knowledge and discipline, that is pure basic research. Now, I am conducting a research to formulate or refine a theory. Gusto ko lang i-change ang Florence Nightingale theory. What type of research is that? Okay, that is your pure basic research. Wait, take note, formulate or refine a theory. I am not applying anything here. It's still basic research because theory, di ba, is knowledge. I want to have general principles on human behavior. Okay, I want to have general principles in human behavior. That is still pure basic research. Now, I want to find a solution to a certain problem. I want to find a solution to a certain problem. Yun na. Yung mga nag-pure dyan, gising. Parang kanina may license, ngayon wala na naman. Okay? Find a solution to an existing problem. May problema na. So you are applying it. Okay? Purely applied kasi yun. Inis tong license math dancer. Now, focus on intervention to achieve desired goal. Focused on intervention. Okay, that will be applied. And how to apply principles to solve problems. Okay, how can principles be used? How can principles be used to solve problems? That would be applied. And that would be applied. Now, let's say, for example, I want to study, or let's say, for example, I want to know the level of knowledge of student nurses in med-surg. I want to know the level of knowledge of students in med-surg. That would be basic research. I would want to know what is the effect of breastfeeding on the level of intelligence of students. Okay? Pagkakita niyo, pagkarinig ng word na effect, that would be your applied research. Okay, that would be your applied research. Okay, in conducting quality research, a nurse should follow a logical reasoning or logical process termed as which of the following? Quali research. Tapos sa choices, kung whiz idea, you look at the two opposing choices, one of them would always be the answer. No? One of them would be the answer. So in qualitative research, we have inductive. Okay, inductive. So when I say inductive, that is from specific to general. So if you have conducted a qualitative research, di ba you interview participant 1, participant 2, participant 3, participant whatever, tapos you made the major themes. That is the manifestation of specific to general. Okay, now let's go to 19. The lecturer reminded the committee members that bias in an influence that distorts the study results in qualitative research which will eliminate bias. Ayan na naman. Yung mga grammar sabi dyan, sasabihin parang karong man sang statement. Okay? The lecturer reminded the committee members that bias in an influence that distorts. Guys, sometimes do not focus on the grammar. Sad to say, do not focus on the grammar. Borborigni, in qualitative research, which will eliminate bias. Okay? Triangulation. Can triangulation eliminate bias? Aba, no. Ba, malakas. Okay? Guys, when I say triangulation, what do we do in triangulation? What do we do in triangulation? What do you do in triangulation? Yes, we use something in multiple. So it could be multiple observers, pwedeng multiple interviewers, pwedeng multiple researchers. Okay? The purpose of triangulation, yes, pwede ding multiple references, no? The purpose of triangulation is for you to eliminate bias also, because it would check, guys, if whether the findings of researcher 1 is the same as the finding of researcher 2 and the finding of researcher 3. Okay? But then, it's more concerned on the reliability of the data. Now, randomness. Can randomness eliminate bias? Can randomness eliminate bias? No, yes daw. Okay, yes daw. Okay. Balik tayo, no? Balik tayo dito. The lecturer reminded the committee that bias is an influence, correction nanta na si Borg, that distorts the study results. In qualitative research, sa mga nakakonduct ng qualitative research, may randomization tayong naganap. Okay? May papik-pik tayo sa fishbowl, tapos, uy, siya siguro respondent ko. Di ba, Wiz? Okay. Now, credibility. Can credibility remove bias? Can credibility remove bias? Ay, aba, no man daw. Yes, it can. No? Credibility can remove bias. Can trustworthiness remove bias? Yes na yes. So if I would look at the yeses there, what's the umbrella? Among the yeses there, what's the umbrella? Aba, credibility pa daw. Uy, gising. Okay? What's considered to be the umbrella there? Guys, it's your trustworthiness that's considered to be an umbrella. Huh? Now, let's go back to the concept of trustworthiness. When I talk about trustworthiness, let me see ha. Hindi naman kasi memorize ni Sir niyo everything. So, trustworthiness. Let's talk about trustworthiness. Your trustworthiness reflect the true state of human experience. Okay? So, class, when I talk about trustworthiness, it reflects the true state of, trustworthiness that reflects the true state of human experience. Who are the authors of this? Who is the author that give us the 5 criteria? Very good. Okay, kahit wrong spelling lang ang guba, okay, pwede na yan, girl. At least may license ka na, no? At least sa board exam, walang spelling. Okay, pagbigyan, you, Lincoln and Guba. Okay, so you have Lincoln and Guba, if I'm not mistaken, 1985. Now, there are 5 criteria according to Lincoln and Guba. One of the criteria there, this could be summarized by CD Cap. One of the criteria there is credibility. Another criteria is dependability. Another is confirmability. And then the other one is authenticity. And then the other one is transferability. Okay, CDCAT, Lincoln and Guba, 1985, the criteria for trustworthiness of qualitative research. I retrieved this from the book of Cristeta Tan. Okay? Now, a few questions lang based on those 5 words so that you will be able to at least maka-eliminate ng kayo if ever ma-encounter nyo. Which of the 5 tells us that research finding can be transferred or applied in other settings? The criteria that tells us that the research finding can be applied or transferred to another setting. Okay? So baka mag-ask si Board of Nursing, wala na yung word na transferred baka applied to other setting na siya. Now, the nurse, tama, transferability. During the research, the nurse was trying to have prolonged engagement, persistent observation, triangulation. What is the nurse trying to attain? Again, the nurse is having prolonged engagement, persistent observation, at saka triangulation. What is the nurse trying to attain? That would be your credibility. Very good. Because when you talk about credibility, it's the confidence in the truthfulness of the data. Okay? Confidence na totoo yung data. Very good for saying the word reliability. Okay? So guys, what do we mean by prolonged engagement? Kumbaga, when you will ask a question, you will stay there and you will wait for the very long answer because you know that the thicker the description is, the more reliable it is. So kumbaga if you're trying to investigate whether it is true or not, the more detailed the details of the situation are, you are more certain that it is indeed a true experience. Persistent observation. So you are observing the emotions. And then triangulation also. That's why when you interview, di ba, hindi lang usually na isa ka lang. Usually dalawa kayo or tatlo kayo. So that you can ask your classmate, uy, na-notice mo man to, nga doon, sad siya kang ina. Or doon, na-notice mo man to, nga parang ibang emotions niya when she talk about this. Okay, that is your credibility. How about what refers to the stability of the data for a long period of time? Stable siya for a long period of time. Okay. Someone you can depend on, di ba? Try to think. If somebody is stable for a long period of time, that's someone that you can depend on. Dependability. Okay, I won't define others. It will just confuse you. Now, let's go to number 20. Chumbala, one of the committee members raised the question on how to make an abstract. The question was followed by how many words are required in the abstract. Should APA style be followed? Bakit may parenthesis here? Okay? How many? Ba, may 250 to 350 pa. How many? Based on the EPA, that will be your 150 to 250. 150 to 250. Okay? How about if ang choices is saying 150, 250, 350, 450? Best answer? 250. Ha? Maximum of 250 words. Okay. Pag lower daw para safe. Kailan yon? Okay, so guys, 250 according to APA. What's the latest standard for APA? What's the latest standard for APA? APA 567. APA 567. That will be your APA 7. Okay? When will I use et al? When will I use et al? If how many authors? If how many authors? When I will be using et al. Pag tama nakadamo. How many gan? Inis you. Okay, 3 or more. Very good. 3 or more. Don't be confused. In your schools, it might be saying that if it's 5 or more, you use et al. But in APA standard, it's 3 or more. So it's 3 or more. Okay, Himaya is a nurse researcher in the DOH, assigned to conduct research practices of psychiatric unit. She is given 6 months to conduct the study. After formulating and delimiting the research problem, which of the following will be a priority action for Himaya? Himaya, gidyang nga pangalan. Okay, conduct a literature review. Okay, conduct a literature review. Give me the acronym for the 5 phases of research. Give me the acronym for the 5 phases of research. Oh my God. Oh our God. Imran. Okay. You want me to kuga you? Okay, very good for saying CPID, although I'm not expecting that one. Okay, the acronym that I use is CDED. Okay, nursing process. Ano tani? Bugdaw, oy, bugdaw. Okay? Cannot daan pa, yeah, me too. Okay, daw, mas stop na ko tudlo. Okay, so guys, let's talk about the 5 phases of the research process. You have your CDED. Okay, C stands for, sige na, C. This is something that you need to familiarize. Okay, very good. Your C stands for conceptual phase. D stands for design and planning phase. Okay, E stands for empirical phase. Very good, very good. People who can get their licenses for sure. A stands for analytical phase. And then D stands for dissemination phase. Okay, dissemination phase. Okay, now let's talk about the steps. What's the first step? Under the conceptual phase? You define the, anong first na inubra sa research? What's the first thing that we did in the research? We defined the problem. Okay, so in other words, as what's mentioned in the choices, you formulate and then delimit the problem. So the first thing is problem. Second, after the problem, what would you do next? Review of related literatures. Isipin nyo lang guys ganito. Once you have the problem, you need to do the RRL because you want to know whether may the same study na ba? May conflicting results ba? May solution na ba para sa problem na this? Kasi kapag may solusyon na, you don't need to conduct the research. Okay, that's why it's important for you to do the related literature right away. Then next, what do you do? Tama, no? Imagine mo daw yung research mo kapag tumulong ka. Okay? Now, before that, we are still on conceptual phase. The methodology would fall onto the design phase. Okay? What's next? After the RRL, after the review of related lit, what would you do? Okay? Before the hypothesis, there's something yet. Abstract. Sumbagon, nakakaroon nag-abstract. Sumbagon, hindi ako malambot, nakasumong. Okay? Before that, guys, the objectives, you would have framework. You would have your framework. Among the framework, what would be first? Conceptual or what would be first? The theoretical framework or the conceptual framework? What would be first? The theoretical framework or the conceptual framework? If you're doing quantitative research, di ba, theoretical framework is first before you proceed with your conceptual framework. Okay? Theoretical framework first, then your conceptual framework. And the number 4, that is where your objectives and then your hypothesis would be. Number 4, that is where your objectives and hypothesis will be. Okay? Now, let's proceed to your design and planning phase. When I talk about design and planning phase, somebody was saying earlier methodology daw. Okay? Parang correct naman siya. So guys, first, you need to have your research design. You need to have your research design. Uy, background of the study. Sige. Since somebody mentioned background of the study, what phase mafo-fall si background of the study? Saang phase yon? Conceptual, ha? Conceptual phase yon. Kasi if you can recall, the background of the study is made with the review of related literatures. Okay? It is made with the review of related literatures. Now, so again, balik na ko kay design and planning. So that first, that research design. Number 2, you need to have your yes, study population. Okay, you identify your study population. Number 3, you identify your after population. You identify don't talk about scope and limitations. You identify your sample size. Very good. You identify your samples. And then after that, what would you do? Ano pa? After identifying the sample, what would you do? That would already be your method to conduct your research. Okay, method to conduct your research. Diba? Kung questionnaire ka, dyan na nakalagay kung ano yung mga questionnaire na gagamitin mo. Kung experimental research siya, what is the amount of fertilizer that you will be using? That's already on the method to conduct. Then let's proceed to empirical. Ano ang balta kang ginasang empirical? Diba? We say empirical is 5 senses. Can you recall that? Empirical is 5 senses. So during the application of your 5 senses, you are already doing your data collection. You are doing your data collection. Okay? Analytical. Sa analytical, what do we do? As the term implies, analyze. Okay? In the dissemination phase, what do we do? In the dissemination phase, what do we do? Okay? Dissemination phase class, we present our research and communicate our research to other people. Okay? Sige. Now, let's review. The nurse is using the questionnaire to gather the data. What phase is that? Using the questionnaire to gather the data. What phase is that? Okay, that will be your empirical. The nurse is using t-test. The nurse is using t-test. What phase is that? That will be analytical. Analytical. Very good. The nurse is trying to find out whether to reject or accept the null hypothesis. The nurse is trying to find out whether to reject and accept the null hypothesis. Okay? Sige, sa mga sumasagot po ng phase 2, okay, pwede na po kayong lumabas. Sa mga sumasagot po ng conceptual phase, try to think. In the conceptual phase, what did I say? Are you testing the hypothesis there or are you formulating the hypothesis? Okay? So guys, sa conceptual phase, you are formulating the hypothesis. When will I be saying whether I will reject or accept the null hypothesis? That will be your analytical phase. Okay, very good, analytical phase. Oh, I went to the Department of Health and then shared to them the result. That would be Okay, step 5. I am doing research utilization. I develop a technology from my research. That would be dissemination. Ayos? Okay, so again, what's the acronym that we use for the phases of research? You have your CDET. Okay, you have your CDET. Try to recite to yourselves what's the meaning of CDET. Try to recite to yourselves what's the meaning of CDET. Okay. Importante hindi ikaw ang dead. Ha? If I will be asking you advice. Uy, bag walang timo kamaan ka dyan. Congrats kay may you learned something new today. Ano na gani pagtawag? If I will ask you, what is the blueprint of the research? What is the blueprint of the research? Answer? What's the blueprint of the research? Research design. Very good. Okay? Research design. Oh, it's not the theoretical framework. It's the research design. Okay, hala, nabasahan mo na. Tiya mo ginagay isang feeling nyo sa board exam. Hala, do ka familiar. Tiya, asta na lang siya galing sa familiar. Okay, now where are we? I want to touch a little muna on the analytical phase in case that time would not allow us, no? In case medyo ang time natin alanganin. Let's touch the analytical phase. In the analytical phase, you are using already statistics. You are already using statistics. Okay? Dapat big S yan. Statistics. So if you will be asked, what is the branch of mathematics that is concerned with the frequency, central tendency, that would be your statistics. Okay, that would be your statistics. Pero may term na statistic eh. Wait lang ha, may term na statistic. Let me recall. Anybody who could tell me? Somebody's telling me about sample. Yes, something that is related to that. I see. What do you call sigway gamay? What do you call the data gathered from a population? What do you call the data gathered from a population? Starts with letter P. Porque. Data gathered from a very good parameter. Very good parameter. Okay? Para nakapatalino you. Napakatalino you. Okay, pamilya. How about data gathered from a sample? How about data gathered from a sample? That would be your statistic. Huh? This is the statistic that I am thinking of. Okay? Sige, let's go back to statistics, which is the branch of mathematics. Now, anong tunaan sa statistics, man? Let's talk about this. When I talk about statistics, guys, there are two main branches of statistics. One of the branch is descriptive, and then another branch is inferential statistics. So if I will be asking you, what branch is concerned of making conclusions? What branch is concerned of making conclusions? Okay? Yes, ANOVA, chi-square. Sige, we'll talk about that. What branch is concerned of making conclusions? So guys, that will be your inferential statistics. Basta making conclusions, that will be your inferential statistics. Now, what branch of statistics naman is concerned of hypothesis testing? What branch of statistics is concerned of hypothesis testing? Ay, ara na naman. Hypothesis testing. Pag mag-test ko sa hypothesis, di ba I will end up by saying there is no significant. There is a significant. That is still inferential statistics. No? Hypothesis testing, my dear students, future nurses, would fall on inferential statistics. Because the purpose of your descriptive statistics is to describe. The main purpose is to describe. Now, under descriptive statistics, there are two particular measures there. You have the measures of central tendency and then the measures of variability. Okay, measures of variability. Please guide me if I'm missing things. I don't have a handout for this. Now, if I would look at measures of central tendency and variability, which of the two would tell us how spread the data is? Which of the two will tell us how spread the data is? That would be variability. Okay? Diba? Paminsan-minsan guys, if you are intelligent naman in English, parang kaya ng mga reading comprehension yan, diba? Okay? So yes, that's the measure of variability. Anong STD? Standard deviation. Makala ko yung mga sexually transmitted diseases. Now, measure of central tendency. Give me the three most common measures of central tendency. Very good. That would be your mean, that would be your median, and that would be your mode. I'm using there also the shortcuts, mean, median, mode. Now, if I talk about the middle value, what is the middle value? Mean, median, or mode? The middle value class would refer to your median. The middle value would refer to your median. If I talk about average, that would be your mean. Very good. If I talk about the most frequently occurring values, that would be your mode. Okay? Most frequently, that would be your mode. Okay, practice, no? Baka dito nyo lang magamit yung mga calculators nyo sa board exam. Now, let's say for example, the data is like this. Okay, guys, what is the median? What is the median of the data here that I have? What is the median? Very good, sang 6, no? Hoy, gising! Na, tanda mo pag nagsabat sang 6, bugtaw! What is your median? Guys, when I'm talking about the median, yes, very good, Adonis, you need to arrange it. Okay, you need to arrange it. Okay, so guys, don't fall to the trap, no? It could not just be that easy for you. So you need to arrange the data. By the way, what do you call an arranged data set? This is a data set. What do you call an arranged data set? Starts with letter A. Data A. What do you call an arranged data? May ko kasagang sa imo, bro. No, ba pag data array. Ha? Array. Okay? Arranged data set is referred to as data array. Hey guys, what's the median? What's the median again? Okay, the median is 7. Kung makakorek-correct siya nga array, kung no layo-layo. Now, what's the mode? What's the mode? What's the mode? Okay, the mode is also 7. Okay? Now, what's the average? How do you compute for the average? So 5 plus 6 plus 7 plus 7 plus 8, okay, divided by 5. Assuming wala kita calculator, 5 plus 6, 11, 7, 7, 14, 8, 22, 33 divided by 5. So that would give you a value of 6.6. That's your average. Okay? Sige. Now, when I talk about deciles, baka ma-encounter nyo lang term na decile, quartile, percentile, where would they fall? Measures of central tendency or measures of variability? Measures of central tendency or measures of variability? Guys, decile, quartile, percentile. Okay? Class, what does decile, percentile, and quartile do? Pag decile siya, it divides the data into 10 equal parts, di ba? Okay? Pag quartile, it divides the data into 4 equal parts. Pag percentile, 100 equal parts. It is still a measure of central tendency. It's still a measure of central tendency. Okay? Hindi na kita magpadalom, alang-alang na para sa isa ka crash course. Now, measures of variability. The most common here that you have is variance. What's the square root of your variance? What's the square root of your variance? The square root of your variance is, sumbagon kung nagsabat sang ANOVA, 13 days to go ka dyan, ibabalik kita sa 26 days to go. What do you call the square root of your variance? Afam kayo. Okay, Adonis, very good. That will be your standard deviation. Guys, the square root of your variance is your standard deviation. Now, standard deviation squared, that would be your standard deviation squared. That would be your, sige na, that would be your variance. That would be your variance. Uy, hala, basic to, basic. Papasok sa Coco Brain. Now, let's say for example, the standard deviation of group A is 1.6. The standard deviation of group B is 2.5. Let's say sa square yan. Sa square nila sa exams ko, halimbawa. Standard deviation of section A is 1.6. Standard deviation of section B is 2.5. What can I conclude? Who is the more homogeneous group? Who is the more homogeneous group? Okay, that would be your group A. Okay, homogeneous group ang group A. Now, who is considered to be the more heterogeneous group? Who is considered to be the more heterogeneous group? That would be your section B. Now, if I will ask you, saang section kaya na maraming matalino pero marami din naman ang mga hindi pinagpala? sa anong section na maraming matalino at maraming hindi pinagpala? That would be section B. Okay, that would be section B. Okay? Why I'm not talking about your specific sections, kainis you. Okay? Guys, if I have two diagrams here, okay, which one would represent section B? Is it the diagram on the left or the diagram on the right? The one on the right. Okay, the one on the right. That is how we represent variability. Okay, so if you will be asked kung mas mababang standard deviation, more homogeneous siya. Pag mataas naman siya, it's more heterogeneous. Okay, I think that's it for descriptive statistics. May isa pa. The most frequently used, may dalawa. What do you call the term that refers to the number of occurrences of a particular value? The number of occurrences of a particular value. Okay, very good for saying frequency. Yes, you will have your license. And what do you call the number that pertains to a particular value divided by 100? Expressing frequency in terms of 100. Expressing frequency in terms of 100. That's not percentile, Okay, when you express a frequency as a proportion of 100, what is it? Percentage. Okay, percentage. Percentile, guys, it divides the array into 100 equal parts. Percentile, it divides the array into 100 equal parts. Okay. Okay, I hope ma-absorb nyo na. Sige, try. Mean, central tendency, or variability? Mean. Okay. Standard deviation. Standard deviation. I want to know the average performance of BSN batch 2022. What would I use? I want to know how spread the data is. I want to know how spread the data is. That would be your standard deviation and your variability. I want to know the range of the scores. I want to know the range of the scores. When I say range, that will be the highest score minus the lowest score. What am I measuring? Central tendency or variability? Highest versus lowest. This is your variability. Okay? Guys, we are trying to differentiate here, no? We are trying to differentiate how far the scores are. So it's the difference between the highest and the lowest, that's variability. Okay. Magets? Can you get it? Are you getting it? Okay, sige, sige. Sige, somebody is asking answer for number 16. Medyo nahalayo ka na, girl. Number 16, that's respondents. Number 16 pertains to respondents. Okay, sige, let's talk about measures of, let's talk about inferential statistics. Okay, inferential statistics. So guys, when I talk about inferential statistics, as mentioned earlier, you are more concerned of hypothesis testing. Okay, you would have there your p-value. Let's talk about first the p-value. When do you reject the null hypothesis? When do you reject the null hypothesis? If the p-value is blank, less than, greater than, equal. If the p-value is less than, greater than, or equal. Don't give me the values yet. Less than, greater than, or equal. God, guys. When do you reject the p-value? If the p-value is less than, greater than, or equal the alpha value. Okay? Students, students, guys, you reject the null hypothesis if the p-value is less than the alpha value. Okay? Lagay sa Coco Brain. Again, you repeat that to yourself. I reject the null hypothesis if the p-value is less than the alpha value. Okay? Is less than the alpha value. Now, example, if the p-value is 0.04 and the alpha value is 0.05, decide. If the p-value is 0.04 and the alpha level is 0.05, what would you do? You would reject because the p-value is less than the alpha value. So you need to reject the null hypothesis. Okay, you need to reject the null hypothesis. Kuha? Ha? Can you get it? Can you get it? Okay, papasok sa Coco Brain. Another term for your alpha value is your set level of significance. Another term for your alpha value is set level of significance. Pag hindi na kaya na ni Coco Brain, ang importante, less than reject. Basta less than reject. That would already help you a lot in the board examinations. Now, we commit errors. We are committing errors. You have your type 1 error and then your type 2 error. What did we do in type 1 error? What are we doing in type 1 error? What's the wrong that we have committed in type 1 error? Sige na, when I talk about type 1 error, what did we do? Okay? Guys, ito lang isipin. Type 1, reject. Basta type 1, reject. Okay? That's what you do in your type 1 error. In type 1 error, guys, you rejected what is supposed to be true. You rejected a true null hypothesis. You rejected a true null hypothesis. Okay? Yan yan. Type 1. So what I commonly say to myself is reject. Type 1, reject. Since error siya, gin-reject ko siya when in fact true sana siya. Now, type 2 error. What did I do in type 2 error? I accepted what type of HO? I accepted a false null hypothesis. I accepted a false null hypothesis. So just think, guys, that in type 1 error, nag-reject ka. Ni-reject mo siya, pero siya na sana. Okay, that's your type 1 error. Type 1, reject. Okay? Kindly think of that. Now, that's your type 1 error. Sige. I think that's the important concept there. Now, let's go towards your inferential statistics. Guys, you have two primary categories here for the statistical test. You have the test for differences, and then you have the test for relationships. You have the test for differences, and then you have the test for relationships. Okay? Ba may gahugot? For your test for differences, this is where your t-test would fall. This is also where your ANOVA would fall. And this is actually where your z-test would also fall. But z-test right now, less frequently used naman lang. Now, if I want to compare two groups, what would I use? T-test, z-test, or ANOVA? If I would want to compare two groups, what would I use? T-test, z-test, or ANOVA? Okay, in a while. Okay, so guys, you can use t-test. Guys, t-test or z-test actually are used to compare two groups. No? They are used to compare two groups. Okay? Ang pinagkaiba lang, guys, si z-test less than 30, si t-test greater than 30. Okay, 30 or more, that will fall on t-test. Okay? Pero z-test right now, parang hindi naman pinag-uusapan. Now, if you would want to compare 3 or more groups, that would be, if you would want to compare 3 or more groups, that would be your ANOVA. Okay, 3 or more groups, that would be ANOVA. Now, I would want to know who is more intelligent in mathematics, male or female, men or women. What would I use? T-test or ANOVA? That would be T-test. I would want to know on the grades on MS, who is more intelligent? Section A, B, C, D, E, F, G, H, I. Okay, that would already be your ANOVA because I am comparing several groups. Now, I would want to know which of the following countries would have a higher happy index. Higher happy index. Philippines, Japan, Singapore. What would I use? That would be ANOVA. Okay, as long as you compare more than two groups, that would be right away your ANOVA. Now, let me see. For the test for your relationship, waits lang ha. I'm trying to retrieve muna the non-parametric counterparts. Okay. Guys, for your t-test, there are two types. You have what you call your independent sample t-test. Where's the chat box? Chat box here. Guys, for your t-test, there are two types. The two types of your t-test are your independent sample t-test, and then you have your paired sample t-test. Guys, I will give examples na lang with the hope that it will make you understand. Independent sample t-test, guys, I would want to compare male versus female. Okay? Kumbaga, male group, walang kinalaman kay female group. They are independent from one another. Since they are independent from one another, what you use is independent sample t-test. Now, when do I use paired sample t-test? If I have the same respondents, but I need to observe them before and after. If I have the same respondents, but I need to I need to compare them before and after. For example, I had this set of people, my respondent group A, and then I give them some food, and then I will check again on respondent group A whether they became happy or not. They are the same respondents. I'm just comparing the pre-test and the post-test result. It's referred to as paired sample t-test. It's referred to as paired sample t-test. Bakit siya considered paired? Kasi the data class will be paired, no? So respondent 1, what happened before eating? What happened after eating? Okay? Sige, let me give more questions so that I'll know whether you understood it. I would want to compare if what is more effective, drug A or drug B. What would I use? T-test for independent samples or paired t-test? Drug A and drug B, what would I use? Independent. Okay? I would want to know whether the levels of insulin increased after drinking Coke. I would want to know whether the levels of insulin increased after drinking Coke. Yes, that would be your paired sample t-test. Very good, very good. I'm happy for that. Now, let's talk about the test for relationships. Guys, there are actually many tests for relationships. No? We need first to understand the levels of measurement before we can jump on the test for relationship. What are the four levels of measurement? What are the 4 levels of measurement? Anybody? Yes, give me the acronym for the 4 levels of measurement. That would be your NO, yes, in that order, NO, I, and R. Very good. You have your NO, I, and R. Now look at the 4. Which one has an absolute 0? Which one has an absolute 0? Which one has an absolute 0? Very good. That would be your ratio scale. Sa mga confused pa, ratio ends with O, it has absolute 0. Now, which of the 4 would tell us that 0 does not exist? Which of the 4 tells us that 0 does not exist? Na-confused kayo. Which of the 4 will tell us that 0 does not exist? 0 does not exist. I'm still talking about zeros. Basta absolute 0, guys, the problem is between interval and ratio lang. Okay? So we said that ratio is an absolute 0, di ba? Ratio has absolute 0. Since absolute 0 siya, guys, it tells us that 0 does not exist. Okay? In other words, totoong-totoo na 0 siya. Totoong-totoo na 0 siya. That's your ratio scale. Now, among the 4, which could I add and subtract? Which could I add and subtract? Among the 4, which could I add and subtract? Somebody answered nominal. Try to think, male and female. Can I subtract male and female? I cannot, diba? I cannot. Okay? Yes, very good. Interval. So guys, your interval and ratio, you can add and subtract. Ratio, you can add, subtract, times, divide. Now, if I talk about ranks, if I talk about ranking, that would be ordinal. If I talk about data that cannot be ranked, cannot be added, cannot be deducted, cannot be divided, that would be your nominal. Okay, that would be your nominal. Okay, that would be your nominal. Excuse me a little while. Okay, sorry for the interruption, guys. Now, where are we? Sige, let's talk about male and female. Nominal, ordinal, interval ratio. Male, female, nominal. Order of birth, ordinal. Cum laude, magna cum laude, summa cum laude. Ordinal. They are in order. Okay? No, they could not be interval. Grades in MS. Grades in MS. Grades in MS. 1.0, 1.25, 1.5. They are ratio scale. Very good. Height and weight. Height and weight. Height and weight. Okay, they could be interval or ratio. Sige na, I will not give you a headache as long as you can identify them as either interval or ratio. Okay. Now, guys, for the test for relationship, you need to be able to identify first the independent and dependent variable. Okay? Now, let's say ordinal. When I will be having the relationship between two ordinal variables, that would be your gamma. Okay? That would be your gamma. Two ordinal variables, that would be your gamma. Now, if I would want to determine the relationship between nominal, ordinal, I will be playing between chi-square, and then you also have Cramer's V. Chi-square, and then you also have Cramer's V. If I would want to determine the relationship between interval ratio and another interval ratio, what do you think is the statistical test that I would use? What is the statistical test that I would use? Any idea? Sige na. Give me ideas there, please. That would be your persons R. Okay? If you would want to determine if there is a relationship between the two, that would be your persons R. Okay? Did I miss a statistical test? What statistical test do you have in question that I might have missed? I am searching still for something. Sige. Okay. Chi-square. Guys, chi-square is also used to determine the difference between categorical data. Okay? Chi-square class could also be used between nominal, ordinal. Okay? Example. If I would want to know the difference on the level of knowledge of male and female, let's say, for example, level of knowledge of male and female, and then I categorize knowledge as high, average, and low. When I say that the knowledge is categorized as high, average, and low muna, guys, what's the level of measurement? If the level of knowledge is categorized as high level and low, a high, average, and low, yes, that is ordinal. And if I would want to determine if there is a relationship between the nominal and the ordinal, that is the time that you can use chi-square. Okay, so if I would want, for example, to determine whether there is a significant relationship between nominal and then ordinal, that is your chi-square or Cramer's V. Okay, chi-square or Cramer's V. Sige. What else? I'm trying to pull out the interpretation for the meaning of persons R. Do you have there the reference value for persons R? There is a reference value kasi for the interpretation of your value for persons R. Do you have that? Is there anybody who has the copy for that? I was not able to, I cannot memorize the range. Okay, but guys, the range are playing at the range are playing between 0.01 to 0.20. Then you have 0.21 to 0.40. Then you have 0.41 to 0.60, 0.61 to 0.80, 0.81 to 1.00. Okay, this is for your persons R. Now, if you would look at it, the higher the value of persons are, what does it mean? The weaker or the stronger the relationship? The higher the value of persons are, what does it indicate? The higher the value of persons are, what does it indicate, guys? It indicates that, sige na, responses please. The higher the value of your persons are, what does it indicate? Let's say, for example, the value of persons are is 0.95. What does it indicate? The value of persons R is 0.95. What does it indicate? It indicates, class, that there is a strong relationship. Okay, it indicates, class, that there is a strong relationship. Okay? Sige. Now, for your persons R, take note that the highest value possible is 1.0. The value of 1.0 in persons R reflects perfect relationship. The value of 1.0 in persons R reflects perfect relationship. Now, for persons R, are the values always positive or could it be also negative? Are the values positive, always positive, or could it be also negative? Any response from the group? Class, pwede siyang may negative. Ha? Now, when the value is negative, what does it indicate? A direct relationship or an inverse relationship? When the value is negative, what does it indicate? It indicates that there is an inverse relationship. When I say inverse relationship, what does it mean? The higher the value of variable A, what happens to the value of variable B? Okay, the value of variable B would be decreased. Okay, the value of variable B would be decreased. Okay, I think we're down to that. Any questions so far? Before I will touch Kruskal-Wallis and then Wilkinson. Okay, wala na. Sige. I'll post a picture on the... Oh, I could not paste a picture here. Medyo may pagkabuki din tayo paminsan-minsan. Okay, I'm posting a picture in... Yeah, I post a link in our chat here. So guys, please look at the parametric and the non-parametric equivalent. Okay, you have the parametric and then the non-parametric equivalent. Now, what do I mean by parametric, guys? When I say parametric, it means that the data is the same as the one in the normal curve. When I say parametric, the data represents the population. Again, how you write it down. When I say parametric, the data represents the population or the data falls under the normal curve. Okay? Sige lang, you pick keywords lang. This is not high time na for you to have an in-depth understanding. Okay, but I'll try to get it slower. Again, plus up parametric. The keywords there is that the word population and the normal curve. You have population and the normal curve. Okay? Sige. Thank you. Now, class, if you can see there on the table that I sent you, from the internet, it tells you the parametric and then the non-parametric equivalent. Meaning, guys, when I mentioned earlier that this is the time that you do paired t-test, once the data is non-parametric, you do your Wilcoxon. Once the data is non-parametric, you do your Wilcoxon. Unpaired t-test, class, your unpaired t-test is also your independent t-test. That's your Mann-Whitney. That's your Mann-Whitney. And then for your person correlation, if you could not do person correlation, because the data is non-parametric, then you do your Spearman's correlation. And then for your ANOVA, the counterpart is Kruskal-Wallis. Okay, the counterpart for your ANOVA is Kruskal-Wallis. I'm afraid as of this time, we don't have a means for you to memorize that, but I mean, memorize it with, wala na ko sang ibang acronym sila nga makuha no, to memorize na. Okay, somebody sent me the, thank you very much to the person who sent me the Garrett's interpretation. I acknowledge it. So thank you. I don't think you don't want to be mentioned. So guys, 0.1 to 0.20, that's negligible relationship. Then 21 to 40, that's low. Then 41 to 60, that's substantial or moderate correlation. And then 61 to 80, that's high. And then 81 to 0.99, it's very high. Because 1.0 is already considered to be a perfect correlation. I don't think that you need to memorize the values now, but you just be mindful that the higher the value, the higher also the correlation. Sige. So guys, please familiarize yourselves with the parametric and then the non-parametric equivalents there. Okay? What else? Sige, it's already 10:10 on my watch. I think it's beyond your time na since you already have a full day also. Do you have any questions in your mind?